Unfortunately, our patients with HS are still facing years of diagnostic delay, and it's a really challenging issue for dermatologists to address because a lot of times they aren't seeing us when they're having this diagnostic delay. They're seeing their primary care or their emergency physician, OBGYN. So we really need to increase our efforts of educating our colleagues, raising awareness, and I also think raising public awareness is going to be helpful. Many dermatologists can tell you that when a patient comes in with a skin disease and they say, I looked it up online and I think I have this, it's usually wrong. If they think they have eczema, it's usually psoriasis. But when they look up HS and say, I think I have HS, it's almost always right. So it's not a tough diagnosis to make, it's just that awareness needs to increase. With having approved medications, we're seeing some increase in awareness where people are getting advertisements and the marketing for these drugs are helping to spread the word and raise disease state awareness, but we still have a lot of work to do, and it's really hard to reach all the primary cares and all the emergency physicians in the world, but we're not going to give up. We're going to keep spreading the word and educating everybody so they recognize HS early so they can get on treatment early and hopefully get under control before it progresses and causes permanent damage. I think the most important advances in HS that we're presenting at this conference are really helping dermatologists understand the intricacies of managing the disease. We have a lot of new therapeutics coming out and a lot of research into pathophysiology, which is fantastic, but the day-to-day management is still a little hard. Some of the key points to remember are the majority of HS patients need a combination of medical and surgical therapy. And when I say surgical therapy, it may be referring them to a surgeon, but it may also be procedures that we dermatologists can do in the office, like de-roofing, punch de-roofing, cryoinsufflation. So as a dermatologist, you can offer a lot of these therapies to your patients. But the majority of patients, we use medication to control the inflammation and then surgery to address any draining tunnels or persistent lesions. It's also really important to know that one flare-up does not mean that your treatment is not working. So when you're counseling your patients, to let them know it's an up and down disease. So we're going to start this new medication and they should pay attention to, are they having fewer flare-ups? Is there more time in between the flare-ups? That helps the patient set proper expectations, and it helps you as well. So you know when they come back, you'll have a more informed conversation about how they're doing and whether they're actually progressing in the right direction and you just need to add to their treatment regimen, or if they aren't having any progress, it's time to kind of change what you're doing.